The treatments at Verita Life is always based on researches and scientific evidence, and this is where primary cancer treatment comes in. All right, it is a combination of different treatments together. We're talking about biological treatments, metabolic, herbal medicine, chemotherapy, in a way that does not harm the patients or doesn't cause any severe side effects like in conventional. Using all this together and having always the right combinations, always trying to get the right treatment for the patients without harming them or without causing them any severe side effects that they could continue on. When we're talking, for example, about vitamin C given in a high dose, or we're talking about curcumin intravenously, or talking even about IPT as a chemotherapy, they're always delivered to the patients in the right way, in the amount that their body can tolerate it and become effective against the cancer. So that's what we're always looking for. The right combination always for each patient, and each patient is always treated as an individual. Vitamin C, we all know it is a supplement that you can buy off the counter. It helps you always to boost your immune system. It helps you to always stay healthy, fights against infection. And this is where the effect of the antioxidant or the antioxidant effect of the vitamin C comes in, all right? And people always ask, okay, so I can take a vitamin C and every day and it will kill my cancer cells. It's not actually that easy. Vitamin C, the reason of it that it's given intravenously is because it has to be given in a high dose. And once vitamin C is given in a high dose, that means the action of it is changing from an antioxidant to a pro-oxidant. And this pro-oxidation effect is what's helping in killing the cancer cells. Vitamin C also could have a very good role when it's combined with certain chemo drugs. It could have the ability to enhance the effect of the chemotherapy against the cancer, could have the ability to reduce side effects, could have the ability to work on certain organs and support the body as well as the immune system, for example. So when we're giving high dose vitamin C or vitamin C intravenously, we are working on different directions against the cancer, and that's where the integrative part always comes in. We rebuild the immune system with the antioxidant effect, and we help to kill the cancer with the pro-oxidant effect. With chemotherapy, even though it is toxic, and even though that it could have severe side effects, but there's always a way of administering chemotherapy and giving it in a certain way for the cancer patients in order to have a great effect with a very low side effects. And this is what we do in Verita Life, and this is all what about integrative oncology is always to integrate the right medicine or the right treatments for the cancer patient. At Verita Life, we use different types of chemotherapies as IPT, as metronomic chemotherapy. Sometimes we even use just a low-dose intravenous chemotherapy. The whole idea behind this is chemotherapy or chemodrugs, they are cytotoxic drugs, that means they kill the cancer cells, but they could they could cause a side effect because they could kill all the other cells. They don't differentiate between a healthy cell and a cancer cell. So at Verita Life, when we do for example, IPT, we are trying to target the chemotherapy towards the cancer cells by giving a very low dose of chemotherapy and getting a very high efficacy of it against the cancer cells, and combining it with different treatments together to increase the sensitivity of the cancer cells towards the chemotherapy. All this happens and the patients usually doesn't feel that they're getting chemotherapy. There's no severe side effects that could happen from the chemotherapy. And also it goes along with other treatments to tackle the cancer from each direction we can. A part of our primary cancer treatment, the herbal medicine, we have established very good protocols with herbs for each type of cancer, and to go along with every possible chemotherapy that is administered to patients, either conventional or in an integrative way. For example, when we talk about curcumin, we all know it is the root, it's the turmeric that could be found everywhere, all right? But when it comes to food or when it comes to supplements, the problems with these, we always need to achieve the therapeutical dose, which means that we need to get into a certain dose that does have the effect against the cancer. Curcumin could be taken as a well-being. It helps against inflammation, it helps against bone pain, different things. But when it's given intravenously, we are bypassing the possibility of the curcumin being poorly absorbed by our guts, because curcumin is not highly absorbed. So when we're giving it through the blood as an IV form, we're bypassing that. We're reaching the high efficacy of curcumin against cancer cells. And curcumin, with all the scientific evidence, if we search on it, there's thousands of studies on how curcumin is working against different types of cancers, including colon cancer, lung cancer, breast cancer, prostate cancer even. They have the ability to kill the cancer cells. It has the ability to reduce the inflammation that is made by the cancers and improve also the quality of life. So curcumin, along with other herbs that we have established for each type of cancer, is given either intravenously, and this is what we mostly do, or could be administered in a high purely oral form, but that could not be found over the counter.